Troubling new findings on mental health for teenagers during the pandemic. A Surgeon General's report out today finds a 51% increase in ER visits for suicide attempts by adolescent girls in early 2021 and a 4% increase for boys. CBS 2's Jenna DeAngelis takes a closer look at the importance of breaking the stigma surrounding mental health for young people.
Hi, my name is Sydney, and I have cerebral palsy. This is how I communicate.
When we met Sydney Moran, she couldn't wait to share she had the best summer.
I went to a special needs camp, and I learned that there are people who are like me. It was the best experience of my life.
But the tenacious 10-year-old struggled returning to school this fall.
I don't like school because I don't have friends just like me.
Her medical diagnoses paired with pandemic isolation created new challenges for Sydney, whose mother is desperately trying to get her out of Greenwich Public Schools.
I have been fighting to try to get them to outplace her into a residential facility that can meet more of her medical and psychiatric needs. It has been unsuccessful.
The district says each child's needs are evaluated by a planning and placement team, but her mother wants the process sped up, concerned for her daughter's mental health.
She was at school a month ago, and she did make a claim that she was going to hurt herself. So she was transported to the emergency room, where she ended up staying for 2 weeks because they could not find a bed in the tri-state area.
Why is it that a patient couldn't get a bed from the emergency room?
Hospitals throughout the state of Connecticut have come together to deal with this crisis. Because there are so few places that have the psychiatric beds for children and adolescents, this has created a real crunch.
The executive director of Yale New Haven Children's Hospital says the pandemic perpetuated an existing mental health problem. Its 40 inpatient beds for children and adolescents have been filled every day. CDC data shows in 2020 a 24% increase in child emergency room visits for mental health, a 31% jump for teens.
Anxiety, depression is enormous. It's almost its own epidemic. The demand is greater than the supply right now.
The American Academy of Pediatrics and other organizations recently declared this a national emergency, advocating for more resources. Here on Long Island, Cohen Children's Medical Center has a partnership with 17 Nassau County school districts to provide access to mental health care and education to staff in the community.
Partnerships between hospitals and schools and pediatric providers are really the way to help resolve some of these issues.
One of many ways the North Babylon School District is tackling this is teaching positive coping skills like exercise.
Chris wants to race. Who wants to race? 3, 2, 1.
Robert Moses Middle School teacher Katie Foreman runs Runch, a program getting kids out to exercise or just clear their heads after lunch.
It's important because we've been able to show academic achievements and also progress and behavior enhancements as well.
School psychologist Desiree Stewart encourages parents to continue the conversations at home.
Ask them questions beyond, like, how was your school day? If they say good, why was it good? How are you feeling? And if they sense something's a little off, ask questions about it. And if you do feel like you're concerned about something, reach out to the support systems in the school.
Many experts and this family hope raising awareness will encourage others to seek help and wrap their arms around this ongoing crisis. Jenna DeAngelis, CBS 2 News.
Such an important conversation. If your child is struggling, we have resources for parents at cbsnewyork.com. Just click on links and numbers.